Welcome back to CBS This Morning. As you can see, we are coming to you from our homes so we can practice safe social distancing during the coronavirus outbreak, but still bring you the news you need to know. And the news today, not good for yet another day. The U.S. has more than 216,000 reported cases of this virus overall, and the death toll rose by more than 1,000 yesterday alone, now topping 5,100. The mayor of Los Angeles is urging the city's 4 million residents to cover their faces if they leave their homes. Now, that goes beyond state and national guidelines, but Mayor Eric Garcetti said people should not wear the medical-grade mask needed by healthcare workers. So, Gail, it seems like the deeper we get into this crisis, the more the guidance on the face mask seems to evolve.
Yes, you're so right. I'm now even rethinking wearing a mask, but the most important thing is that the nurses and the doctors who need it get it. And that's what we're talking about, Tony. The nurses at 15 hospitals in 7 states, they're protesting this week over what they call a lack of preparedness by a major U.S. hospital chain. They say the shortage of protective equipment is putting them and their families and patients at risk. Senior investigative correspondent, that's Catherine Herridge, has their stories.
What I can tell you is it has quickly grown into a war zone.
ICU nurse Diane Case shot this video inside her Yonkers, New York hospital because she says she's so concerned.
This is the painter coveralls.
The lack of personal protective gear is putting her and her fellow nurses at risk.
No isolation gowns.
And we are riddled with fear and anxiety because we don't have the proper equipment to take care of these patients. So what? We're expendable. That's how we feel.
CBS News spoke to more than a dozen nurses in 6 states who said their hospitals or nursing homes are rationing critical supplies. It's now routine to reuse gowns and masks.
It's not made to be used multiple times.
Shelley Hughes works at a long-term care facility in Washington state. Her husband found a box of N95 masks in their home emergency kit.
I wish I had enough to give them to everyone, but I gave one to a young lady that I work with who's 7 months pregnant.
My fear is that since the measures and response from the state has not at all matched the need or the crisis, I'm afraid that I'll see my coworkers dying.
New York City ICU nurse Trey Kwan came back from maternity leave last month.
I was really torn about returning because I was worried about leaving my baby and breastfeeding and also just bringing back, the virus. But I couldn't stay home and kind of watch.
She returned to overwhelmed emergency rooms and colleagues with coronavirus symptoms.
The units and nurses are getting sick. We are in the ICUs now as patients.
But going public about their concerns also has risks. Asked what is at stake during our interview, Diane Case said,
My job and quite possibly being branded. There's a real big line here. And doctors don't face the same retributions that nurses do.
They are also deeply conflicted.
The guilt toward not tending to patients right now outweighs the guilt toward my family.
No healthcare worker deserves to martyr themselves to this broken system.
I can't kiss my children. I can't hug my children. And this is going to go on for months. We work hard for our patients because we're impassioned about what we do. But we didn't sign up to be exposed to a killer virus without proper protection.
Since our interview, Shelley Hughes, who gave one of her N95 masks to a pregnant colleague, has begun self-isolating. Hughes has some symptoms, and she doesn't know whether it's her asthma acting up or COVID-19, Gail.
Catherine, I'm so glad they're speaking up. Without them speaking up, changes will not happen. Thank you so much.